Hi there, my name is Jeff Moga. I'm an associate professor at MacEwan University uh, in the Department of Allied Health and Human Performance. And today I'm going to talk to you a little bit about the massage therapy program. Before we get started, though, just some quick facts about MacEwan University, and you can see there's some pretty nice statistics here with respect to a variety of things. Number one, 89% of the alumni remain in Alberta. So many of our graduates are staying in Alberta and giving back to the community, which is great. You can also see the stellar employment rate, 92%, and of course, 74 are employed in fields where that were related to their programming, and of course, 92% satisfied with their decision to attend MacEwan University. Um, so what we have here is a couple shots about campus, around campus. You'll see that it's a beautiful campus in the heart of downtown Edmonton. This building here in particular that you see is the Robbins Health Learning Center, and this is where we're situated. This is where we spend most of our time, although we do have classes across campus, which span several blocks downtown. But this is where our labs are and many of our classes take place. It's also where many of our other health programming is offered. Things such as nursing is in this building as well, acupuncture, hearing aid practitioner program, OTA, PTA assistant programs are also housed in this building. This is the library, a little shot of that. There are virtual tours of the campus. If you are interested, they're online on MacEwan.ca. And this is here just a quick shot of our residence where many of our students spend the academic year. So what are we going to talk about today? Well, there's a bunch of things here we're going to talk about in terms of what massage therapy is. We're going to look at what knowledge you're going to gain from taking a massage therapy program. Why would someone seek the expertise of a massage therapist? Of course, what roles and responsibilities do massage therapists have? Employment potential, and of course, what sets MacEwan apart from other programming that's out there? Of course, there'll be an opportunity for questions as well at the end, and I'll give you some contact information as well for advisors that can also support you in your future academic endeavors. So what is massage therapy? Well, this is the scope of practice. This is what massage therapists do, and you can see here it's kind of technical, but if you think about it, we break it down into simpler terms. Massage therapy is simply we do assessment of the soft tissues and joints of the body to get an understanding of what's wrong with somebody, and then we apply soft tissue techniques, soft tissue being muscles, ligaments, these things, as well as we do techniques to joints to obviously improve function. And oftentimes we're also dealing with pain and reducing pain in many cases. So this is what massage therapists do. And it really takes a lot of practice and skill to be able to pull that off. So what do we need to acquire in order to get to that point? Well, you can see here, number one, we're looking at learning a lot about human anatomy. You can imagine a program such as massage therapy or any of these health programs that require a hands-on approach. There's going to be a lot of information coming at you about the body. You're going to learn all those bones. There's 206 bones in the body there, so you're going to look at that skeleton a little bit differently and understand each of the joints that you see there. You'll understand there's little bumps and nodules on each of these bones. You'll understand what those are for. And as well, you look at the muscle side of things. You're going to be learning all about the muscles of the body, getting an understanding of what to expect there in terms of the origin of a muscle, where it starts, where it ends, what it does when I contract a muscle, how does it affect the skeleton. So a lot to learn there in terms of anatomy. Of course, we also need to know how the body works. So physiology is another interesting aspect that you'll take a stab at in this program. You'll learn how the muscles contract. You'll learn how the nerves fire. You'll learn how the kidneys function. You'll learn all sorts of things about how the body works. So massage therapy does have a profound effect on the physiology of the body, and you'll learn how that interaction occurs. We also really focus on critical thinking. Obviously, in any of these health professions, critical thinking is vital. And the thing that we really like to do with the massage therapy program is embed a research track. So to ensure that you are developing critical thinking skills throughout the 2 years of this program. The research stream that we embed helps you analyze research and make sure that anything that you do when you're treating a patient or client is research informed. We also, of course, focus heavily on techniques. Not only are we learning how to use our hands and benefit someone's condition by using and applying various techniques, we're also really concerned with body mechanics and making sure that our posture is appropriate. We really want to focus on career longevity and personal self-care. We want massage therapists that graduate from our program to have long, fruitful careers. And part of that is based on using your body correctly. Many people say, if you're a massage therapist, your hands will get really sore really quickly. Is this true? Uh, if you're using your body improperly, yes, it is. There's a lot of ways that we can show that we can use our body smartly rather than using intrinsic muscles in our hands. Instead, we would like lean into techniques, use a little bit more depth just by transferring body weight rather than intrinsic hand or upper body strength. We also talk a lot about communication. Now, communication is vital in any health profession, and of course, communication is important between the massage therapist and their patient or client, but also is important for massage therapists to communicate with other health professionals. Quite often, you'll be working in conjunction with chiropractors, physiotherapists, acupuncturists, etc. And therefore, communicating with those professionals is on another level in terms of using proper terminology and various things. But also basic communication skills are really addressed. And not only will you be a better communicator, you will also be a better writer by the time you're done the program. Why would someone seek the expertise of a massage therapist is the next question here. Well, there's a variety of things that massage therapists treat on a regular basis. You can see everything from whiplash to arthritis, sciatic pain, sports injuries, you name it. There's a variety of things that massage therapists do. So the 2-year program offered by MacEwan University prepares you to address any of these situations that you see in front of you. And this is just a small example, actually, of what massage therapists treat. Now, what are the roles and responsibilities of massage therapists? Well, you can see here, this is essentially what massage therapists do, and the 2-year program that we offer prepares you really for this. Number one is we do a detailed health history, which means we look at somebody, when they come in, they will fill out a form. So the form will tell us basic health information on that person and start guiding our assessment. These forms are called health history forms. You're probably familiar with them. Similar forms you fill out when you go to the dentist for the first time or a doctor, chiropractor, you name it. And these are very similar in the massage therapy world. Gives us an overview or a snapshot of that person's health. Then we move into the clinical assessment. So you have 2 clinical assessment classes that you'll be taking over the 2 years. The classes are very structured so that you can evaluate an individual and determine what's wrong with them. So for example, if someone came with a shoulder injury, well, the shoulder is a very complex area. There's many things in the shoulder, lots of different muscles in play, and other structures as well. So if someone comes in with shoulder pain, you will develop the skills to figure out what exactly is causing their pain. So that might be, could be a tendon, could be a ligament, could be the joint. You will develop the skills to figure all that out. Then once we have an idea of what's wrong with the person, we can then, of course, come up with a treatment plan. And the treatment plan is basically what we're going to do to help that person's scenario. So if someone came in with whiplash, we'll do an assessment to find out exactly which structures are damaged, and then we will follow up with our treatment plan to improve their whatever disability or ailment they have. For example, it could be just neck range of motions reduced, something like that. So we do come up with a treatment plan, and then so that's our plan, what we're going to do for the person and how we're going to benefit their condition. Then we actually apply the treatment itself over a period of weeks, usually, depending on the condition itself. So we do the treatment. Of course, we're always evaluating how things are moving along with the treatment. If the treatment isn't working as we thought it might, we might adjust it accordingly, or it could be moving along just perfectly. The other thing then we do after the treatment sessions are done, we do also post-treatment evaluation. So we make sure that things are moving, like I said, forward as we want them to. If you're finding that someone's not getting better, then it's probably an opportunity to change things up, perhaps refer that person out. So we do always evaluate, it's ongoing. And then of course, education, patient education is important too. You can see in the picture here, there's someone doing work with some bands. and they might be strengthening in an area that's weak. And so we often send people home and you can see the next point there, home care program with various exercises, strengthening, stretching, you name it, to help better their condition. Part of our education as well is educating them on their condition and trying to, hopefully make some positive lifestyle choices perhaps that will benefit them. And then, of course, we'll communicate with other health professionals. Like I said, if you run into a point where you're having difficulty improving this person's condition, you may move on and have them referred to another health professional. So the employment potential for massage therapy is pretty diverse. You can see everything from self-employment to working in a spa or a cruise ship. So you can see self-employment pretty common. People will start their own businesses, whether it's home-based or whether it's in a storefront kind of concept, leasing a space. Many will work in a multidisciplinary clinic, working with other healthcare practitioners, which is always a fun thing to do. So you collaborate with other health professionals to better someone's condition. There's also out-call or home visits. Some people would go take their portable massage therapy tables to varying places, people's homes, people that have difficulty getting out. And so there's home visits that can happen. There's also sport massage. So any professional sporting team has a massage therapist on staff. Even right down to youth hockey and sports and lacrosse and these things all have the massage therapists or trainers that work with them. And of course, we can get into if you like to get the travel bug, there's a whole bunch of different things you can do with that. There's spas all over the world, resorts, cruise ships. A number of our graduates have gone to Cayman Islands and worked for a year in a nice setting in a resort, those sorts of things. Hospital settings are also becoming more and more common for massage therapists, working in a variety of hospitals, which are really great. Obviously, many patients really appreciate the care that massage therapist provides in conjunction with their medical care. And of course, on-site corporate, many massage therapists will take a massage therapy chair, which you see in the picture here, and provide massage therapy to, at a large business, such as one of the high rises in downtown Edmonton, for example. They'll set up and they'll see employees of a certain company all day. Of course, it helps them with their concentration, gets them, kind of limbered up for their day, and is a nice break for employees and a nice perk as well. So I came up with a little list of reasons to choose massage therapy at MacEwan University, and you can see here the MacEwan Griffins logo. That's one of them. There's a lot of sports that goes on at MacEwan University. It's a lot of fun to go to games and check out various basketball or volleyball. There's hockey at the downtown arena. So there's a lot of fun things to get into at MacEwan University. But one of the things I think is most important is MacEwan University is a teaching-based institution, putting students first. And that's the key here is number one stakeholder is our students, and we want to make sure that the students are happy. So all of our instructors are aware of that and really want to see students succeed. And we really go to great lengths to see that happen. It really makes us as professors really happy to see students developing, improving, and being successful. We also have qualified faculty. Many of our faculty well, all of our faculty are well trained, and they're all very well trained and versed in the specific course that they're teaching. So that's always a comfort. You know that the person that's there has got years of experience in massage therapy or has years of experience in anatomy or assessment. So all of our faculty are picked and vetted and ensure that they have that expertise before they step in the classroom and experience as well. Student support is really important at MacEwan University as well, lots of it. And I'll show you some examples of the student supports that are available shortly. We also have a very relevant and up-to-date curriculum that we provide. We have a national standard that the massage therapy program at MacEwan University follows. This national standard ensures that we're up with the most current research and the most current learning outcomes that are put out there for the massage therapy profession. So we're always making sure that our curriculum is at a standard or above that standard. And we're regularly reviewing our curriculum to make sure that it maintains relevancy. We also have highly sought after graduates. We get lots of phone calls, people clamoring for our grads every year. MacEwan University graduates from the massage therapy program in particular are very well sought after and renowned uh, across the province. We do offer a very intensive clinical and field experience at MacEwan University. So you're going to get a whole bunch of different experiences throughout your 2 years of the program. You're going to be at sporting events. You're going to be working with seniors. You're going to be working at childcare homes, um, childcare centers, I should say. You're going to be working with the public in our inpatient clinics, outpatient clinics, that is. And it's a really good overall experience. So we give you like a taste of everywhere a massage therapist can go. So you'll be working with pregnancy, you'll be working with infants, you name it. We're giving you that full 360 view of massage therapy. And then it's up to you when you graduate where you want to take that. The university experience is fun. Being on campus, MacEwan University, you can't help but feel the energy and the vibe. There's always lots of stuff going on, as mentioned with the sporting events. There's welcome barbecues. The Students Association at MacEwan University hosts a number of great events. There's lots of things to get involved with. Of course, we have a very nice pool, great gymnasium, and fitness center as well that students are welcome to use. So it's a really good energy on campus, and being in the heart of downtown is never a bad thing. Lots of restaurants and entertainment in the area as well. We do have also state-of-the-art lab and equipment. All of our equipment is there for your safety. Our massage tables are electric lifts, so they come up and down. They have all these different adjustments to make sure that when massage therapists are learning and practicing, they are doing so in the optimal body position, so they're not hurting themselves. We have a number of heat and cold packs, paraffin wax, so our lab is fully set up to provide you with everything you need to practice. We also have transferability, which is nice. Some programming, you may not get that. MacEwan University has the transferability. What I'm meaning by that is when you're done your 2 years of massage, you can then transfer and ladder into a degree right at MacEwan University. So the Bachelor of Arts, Bachelor of Science, accept credits from the massage therapy program and put you well on your way to getting a baccalaureate degree. So we do have transfer articulation agreements within MacEwan University as well as with Thompson Rivers University in British Columbia. So that's a very nice added bonus if you want to continue your education. Here's some of that student support that I was talking about. And you can see they have everything here for Indigenous students. They have things for career and experience. So if you want to get a sense of where your education is going to take you, there's support there. There's wellness, psychological services. So keeping students healthy and well, both mentally and physically is important. We have access and disability resources. So if you have issues with learning, writing, this department will support you and help you improve, obviously remove barriers from the learning environment. We also have a health center. So there's a full medical center. So looks after the physical and mental health of our students as well. Lots of student support and writing services as well. If you have difficulty writing, we have support there. Our library is amazing. If you're doing research, there's people there to help you and guide you the whole way. Here's some of our students. Talked a little bit about the experiences that you might get coming to this program. Well, here we are at a track meet downtown Edmonton, working with a bunch of runners and athletes. This could be before their event or after. And anyhow, this is some of the experiences that you can expect when you come and informing what we do at MacEwan University. So getting to program information now for you. This is a breakdown of our first year of the program. You can see the different courses here. This is available online. If you look online in the online calendar, you'll be able to pop down each of these courses and it tells you what they're about. There's a little course description for each of these. But you'll see there's a techniques class in each term. Clinical practice starts in term 2 and 3, which carries on through the rest of the program. You can see initially that first year, really introductory, get your anatomy and physiology dealt with, and moving forward to, you can see in the term 3, which is spring, we see now we're starting to get into assessment, very specific type work. Our program does run for 10 months, so we run from September right to the end of June. So you can see we have 3 terms, so we have a fall, winter, and a spring term. Bringing us to our second year of the program, you can see the second year is really more focused on treatment. So the first year gets all the basics out of the way, you start developing your skills, and we just ladder it into the second year where we start looking at treatments. You can see there's a research course embedded there. We have business management to get you prepared for the real world when you graduate from the program. So you can see with our techniques classes, again, we're just taking basics to really advanced type techniques. So you can see we begin very, very small, very simple, and then we just keep building it. So this is some of the techniques that you're going to learn and modalities that massage therapists know, but there's a variety right there that you'll expect to learn, amongst many others. We also have an extensive clinical practice that runs. We have a in-campus clinic, on-campus clinic, and you can see here we do follow a pretty, again, basic to advanced format. We start very basic with advanced, or sort of basic body mechanics, draping, interviewing skills, and then we start going to more advanced treatments. We do case conferences, we write papers, and then there's various internships that we will be sending you off to do, whether it's a sporting or a long-term care facility, you name it. Now, it is a 2-year diploma, as I mentioned. Applications are open now, and deadline to apply is June 30th, 2022. When you come into this program, it's fairly rigid in terms of the schedule of classes. They're only, for example, a techniques class is only offered 1 day a week. So it's not like you have an option to pick, well, I want to take this English over here and I'll take this psychology and it's not set up that way. It's very prescribed in a sense. So there's, very, very few options that you need to pick, but it's a very, very much structured program that, like I said, ladders from one term to the next. Our admission requirements are this. You can see we're looking at regular admission, of course, looking for English, biology, and then any other subject is essentially what that number 3 means there. You can see there it has to be minimum 60%. Typically, when we get our admissions or our applicants, we are seeing like mid to low 70s are actually what's required, but that 60 being the bare minimum that you'd be required to apply. But it ends up being a little higher based on all of the applicants that come in. We do also have a mature admission. All you can see there is we're just dropped the one subject from group A, B, C, or D, which if you look in the academic calendar, it gives you a breakdown of what those are, okay? Those are essentially any high school course, but you have to be 20 to get the mature admission. And then, of course, there's also previous post-secondary work that we evaluate and look at as well as an entrance possibility. We have academic advising. This is the email and the phone number that you might want to write down. This is a place that you can get more information about the program, more information about how you can apply to the program, prerequisites. So just a little bit more detail than what I'm providing you. These folks are great. Okay, so advising at MacEwan.ca or the phone number you see in front of you are what I would recommend if you have further questions. This is the transferability. I think I mentioned this already, so I'm not going to spend any time on this, but you can see MacEwan, we've got the Bachelor of Arts and Science, and Thompson Rivers University in Kamloops also offers some transferability for a program. I'm just going to hide myself here so we can see this full email. Oh, I can't. Apparently I can't hide myself. I'll just spell it out for you. But you can see here, we have massage clinics, and if you haven't experienced a massage, this is a nice, inexpensive way to come and have a massage. We do offer basic wellness massages and, of course, therapeutic massage, which is more focused on injuries, okay? You can phone 780-497-4102, or you can email massageclinic at, and then if I wasn't in the way, at MacEwan.ca, okay? So massageclinic at MacEwan.ca. If you're interested in following us on Twitter, Instagram, and Facebook, there's the way to follow us at MacEwan U. You should also look at this. If you're thinking about applying to MacEwan University, absolutely look at macewan.ca/scholarships. You never know, you might be eligible for something. There is one for massage therapy. There's an entrance bursary, so take a look at it. Um, Scholarships, you would be surprised that there might be a number that you might qualify for. So take a look at that easy to use database you can see in front of you there. And that brings me to the end of the session. So I want to keep it pretty brief, about 30 minutes, which we're at. If you have any questions, please just contact advising at macewan.ca, and they'll put you in touch with the appropriate person that will, of course, answer any of your questions. Thanks for taking time today to listen to this presentation. Hope you take a look at the campus and the virtual tour, or come down and visit the campus at some point. And we'll hope to talk to you soon.